Shyness is a common personality trait and present in 40% of the general population. Feeling some degree of discomfort when you perform publicly or meet new people is a fairly common experience. It is not unusual at all, and most of us will feel shy in certain situations. For example, walking into a party or an event where you don't know anyone, or starting a new job, or having an entire office sing happy birthday to you. But when does this behavior cross over from shyness to becoming social anxiety disorder, or SAD? In this video, I will explore the multiple diagnostic criteria for social anxiety disorder. Welcome to my channel. I'm Dr. B. I'm a board-certified, fellowship-trained physician, and I've been caring for patients for over 20 years. I make educational videos on medical topics that I find interesting. Watch this video to learn how to distinguish shyness from social anxiety disorder, and watch until the end to learn whether there can be successful treatment for social anxiety disorder for you or those you care about. Now, the key determinant in separating a personality trait like shyness from a disorder like SAD is the impact that it has on a person's quality of life. For example, someone who is shy is reserved in social settings, feels awkward, anxious regarding initial meetings or interactions with other individuals. These feelings generally dissipate as the person grows more comfortable and familiar with the situation. While a shy person may always avoid the spotlight, being shy does not keep someone from engaging with the world around them, or trying new things, or having close relationships. This is in stark contrast to social anxiety disorder. SAD is different. It is not only the third most commonly diagnosed mental health disorder, with about 13% of the general population, but it is characterized by extreme, debilitating anxiety about being judged, criticized, rejected, or perceived negatively in social settings. Now, this includes an elevated fear of interaction with others in a variety of social settings, and a deep worry that one will be scrutinized by others. Does that sound like being shy? Well, here's the key difference. This intense anxiety causes impairment in function and interferes significantly with an individual's life and relationships. This is in stark contrast to simple shyness. The American Psychiatric Association uses the Diagnostic and Statistical Manual, 5th edition, or DSM-5, to define social anxiety disorder. Those with SAD have a marked fear and anxiety about social situations because someone with SAD believes they will be judged negatively, embarrassed, or humiliated. Examples include giving a presentation at school or a speech at a job, taking a school examination or a test, meeting authority figures. Now, these could be teachers, bosses, principals, coaches, or even a significant other's parents. Even answering the phone or ordering for oneself at the restaurant. Now, these fears and anxious thoughts are often accompanied by a physical reaction as well, including palpitations, where someone feels like their heart is beating and wanting to come out of their chest, tremors, shaking, blushing, and sweating. Individuals describe taking multiple shirts to school or work because they sweat through them during the day. In addition, if someone with SAD is in a relationship, the non-anxious partner often takes on the role of protector and does the social interacting. They will order food at restaurants, order takeout, answer the door, even pick up the telephone. The anxious individual will completely abdicate these roles to their partner. Number 2, those with SAD fear that they will act in a way or show anxiety symptoms that will be negatively evaluated. So the person with SAD fears that not only their actions, their appearance, their words are being negatively evaluated, and that they're being judged as weak, stupid, boring, or unlikable, but they are anxious about someone recognizing that they are anxious, and they will be judged for that as well. These fears can be expressed in a myriad of ways, including changing the way you walk because of the pervasive fear that someone will judge your normal everyday walk, or packing extra clothes to work or school, to change wardrobes just in case somebody looks at you and you think they don't like the way you look. In an older version of the DSM-4, a criterion of social anxiety was that the afflicted person recognized that the fear was excessive or unreasonable. That criterion, interestingly, has been removed, and the judgment role has been transferred to the clinicians. Now, I think there is still some value to considering this criterion when one is making a self-evaluation. I think it's still valuable to say, are these fears reasonable? Number 3. For those with SAD, the social situations listed above virtually always provoke fear and anxiety. Therefore, this produces a constant avoidance of anxiety-producing social situations, or rarely, if someone with SAD goes through these situations, they endure them with intense fear and anxiety. They refuse to attend parties, office get-togethers, sporting events, or even family outings and traditional holiday meetings. If somehow forced to participate, it is only with tremendous trepidation and anguish, and the fear and anxiety doesn't lessen over time. Number 4. For those with SAD, the fear and anxiety is out of proportion to the actual threat posed by the social situation and the socio-cultural context. This is important. There are times you should be fearful. Bears, for example, come to mind. One should be fearful of bears. However, if one is fearful of a situation that is age and socially appropriate, then SAD should be considered. For example, those with SAD may overcome remarkable barriers in interview for and be selected for multiple jobs, and then be unable to accept a position because they have this overwhelming fear of being fired. This pattern can be repeated over and over, and they will remain unemployed. Number 5, the fear, anxiety, and avoidance causes clinically significant distress and impairment in social, occupational, and other areas of function. For someone living with SAD, their anxiety around social interactions with others can cause severe and obvious physical symptoms, and it can drive them to isolate themselves, limit themselves in order to avoid these reactions. This results in a diminished quality of life for the person with SAD as they slowly cut themselves off from people, places, activities that they might otherwise enjoy in order to find some relief from their symptoms of anxiety. Those with SAD frequently struggle to keep employed, frequently struggle with intimate relationships. SAD ranks among one of the highest psychological disorders when it comes to failed relationships, divorce, and living alone. Number 6. For those with SAD, the fear, anxiety, avoidance is persistent, lasting for 6 months or more, and is not better explained by a medical condition, not explained by a medication or substance abuse. For example, someone that has social anxieties due to severe burn over most of their body, significant facial scarring, or those who experience intermittent anxiety from too many cups of coffee or stimulants like methamphetamines, that doesn't meet the criteria for SAD. So, if someone is more than shy and SAD is present, there is promising treatment available. This is in the form of medications and psychotherapy or talk therapy. Medications are particularly promising for a subtype of SAD known as performance anxiety. If you're interested in learning more about that, let me know in the comments below. Psychologic treatment for SAD is known as cognitive behavioral therapy, or CBT. CBT is a common type of talk therapy where you work with a mental health counselor or professional in a structured way to become aware of inaccurate or negative thinking, so you can view challenging situations more clearly, look at alternatives to your thought process, and respond to these situations in a more effective way. CBT was recently evaluated in a large study in the journal JAMA Psychiatry. The authors, after evaluating a large volume of data, recommended cognitive behavioral therapy for anxiety disorders, including social anxiety disorder, because it was shown to be effective. Those are the clinical criteria and treatment for social anxiety disorder. Thanks for watching. If you're interested in more personality disorders, try this video about paranoid personality disorder, or this one on the difference between borderline and bipolar personality disorder. And please don't forget to hit subscribe.